Barry, thank you so much for joining us. You have a number of facilities. Just tell us a little bit more. Do any of your residents currently have COVID-19?
We do not have any cases of COVID-19 at the moment, Sally. We do have one resident who had exposure to a person who was confirmed as being positive for COVID-19. She has followed our guidelines for self-isolation. She hasn't shown any symptoms at this stage, and she's nearing the end of her self-isolation period, so we hope that turned out okay. Other than that, we have no direct contact cases that we're aware of, or certainly anyone being positive for COVID-19.
What measures are you putting in place to protect the elderly in your care homes? And are you aware if this is an industry-wide thing? Are a lot of private care facilities doing the same thing?
Yes, certainly they are, as far as I'm aware, both in South Africa and around the world. We've put quite a lot of measures in place in the last couple of weeks. I think never before have people had to learn so much so quickly. And what we've done in a short space of time, when I say we, I'm saying the industry as a whole and the world as a whole, is actually quite remarkable. So what we've done is we've looked at World Health Organization and National Institute of Communicable Diseases guidelines, and we've considered what our counterparts globally are doing in the senior living industry. And we've also consulted with specialist geriatricians locally and various doctors across the world as to what the best practice is that we should be implementing in our communities. And I'll give you an example of the measures that we are doing. Some of them are kind of what we came up with ourselves, and some of them are just standard practice. So basically what we've done is we've formed what we call a virtual protective bubble around each of our communities, and these comprise various infection prevention protocols. So just to give you an idea, there's been an extensive education and awareness campaign amongst our staff. We've urged all residents to stay at home and go out to a minimum. We've enforced hand sanitization on entry into all our communities. We've implemented very, very strict access controls, no visitor policy in our care centres. We prevented children under the age of 18 from entering our communities altogether. Any visitor entering has to sign a declaration that they haven't been exposed to any COVID-19 cases, that they haven't been overseas in the last 14 days, etc. We're taking the temperature of all entrants to our communities. If anyone has a temperature reading of over 37.6, they're denied entry to our communities.
The other thing, Barry, that I think is quite interesting what you're doing, because this is a concern for many staff members who are using public transport, have no option but to use public transport. You've got an interesting rotation, a 2-week on, 2-week off. Tell us a little bit more about that. Yeah,
so what we've done is we've implemented a 14-day shift program, and during those 14 days we are accommodating as many staff as we possibly can on site, so that they don't have to commute on public transport. We see that as a massive risk, and as I said, as I spoke about this protective bubble, it's all very well, but ultimately staff commuting every day on public transport represents a risk and almost represents a weak link. So we've tried to almost prevent that risk of infection, and we've worked out that, roughly speaking, and it's hard to get exact numbers, but at the end of the day, this COVID protection protocol is a numbers game. We've worked out that housing our staff on site in that 14-day period actually probably reduces our one-to-one contact for those staff by about 20 to 30,000 events per month. So in other words, that would mean that our staff in total would come into contact via not having to take public transport with approximately 20 to 30,000 less people per month. And of course that has a significant impact of the risk of infection and transmission.
You're right indeed, it is a numbers game, and it's all about flattening that curve. Thank you so much. That's Barry Kaganson. He's the CEO of Aurea Senior Living.